My name is Brent Bamberger. I'm a hand surgeon in Dayton, Ohio, program director of an orthopedic residency at Kettering Health Network. A few things have happened over the last 30 years of being a program director. Actually, not that long, 25 years of being a program director. You start out just with multiple books. You started out with maybe you got lucky and had a specimen lab, but you were learning basically in the operating room. Then as we got a specimen lab, as we have taken off completely and got rid of books and everything is basically online, things have pushed forward. Now the next step is that how do we get reps? This is the classic, and everybody knows books. It's the classic 10,000 hours. It's the classic thing of visualizing something in your head the night before. As Nicholas has said, he never missed a putt in his head. So with virtual reality training and moving forward, you can get reps. We don't have all the haptic responses of feel, but that's what your last couple of years in practice are, and that's what your mentors are for, is to teach you the tips and tricks of tissue tension and retraction. But the steps should be roped. It's easy to do when it's in VR training versus just on a cadaver. But essentially, it's also cheaper. You know, you do it on a specimen, and that's one and done. Next person could try to do it, but it's different. With something like, where we're moving forward into and continue to progress, it's just reps. Most of surgery is reps once you learn the anatomy. But I think the whole thing about PrecisionOS is their ability to listen to some old guys with gray hair and to listen to young guys that are on LinkedIn all the time and be able to meld the two together. So if we've got ideas from history of teaching to ideas of what's going to happen next year or in the future, they're able to put the two things together and listen to put out a great product. Now, repetition's one. Two is you're not hurting anybody. And that could be hurting the specimen so no one else can use it. So you can go over and over and over again. Also, you're able to give good feedback. So it's feedback to someone who's learning. It's a little difficult to do that when you're just working on a specimen, or if you're in an operating room taking care of a patient. So essentially it's repetition. You're not causing any problems, and it's the feedback that definitely will help our trainees in the future. So we've just started in VR in the past 6 months. Developing an indoor curriculum has been challenging, but it's only been 6 months. It's the same thing of we're all going to go to the lab at 4:00. We're all going to do the ABOS modules during the first month. Now it just has to be a culture change and a paradigm change that we're all going to do VR before we do cases. I think the biggest thing is it's the sign of the future, that this is a way that I can feel more confident that to allow you to start doing some of the procedure. It's all good that you can do it on a cadaver one time. It's all good that you can learn all the literature. That's a no-brainer. That's what they should be doing. Now, if they can move forward and do multiple reps and then give feedback, PrecisionOS has helped, and they're listening to us, hence the curriculum that came out. Orthopedic residence before, it was anatomy, right? The literature was easy. There's only 5 or 6 books, basically, that you had to memorize in the late 80s. Now there's hundreds and hundreds and millions of different type of literature you can get there. So you have the ability to get on the literature. Now you need to get reps, and reps are more and more difficult. Meaning reps in surgery, and with using all these different technologies, whether it's VR now or AR in the future or whatever else these brilliant people come up with, there's going to be some other way of you learning. You have all the tools. You just have to do it. There's no great summary other than, simulators came through. They have nothing to do with simulators. They're good, but they're expensive, and it's tough to upgrade them. So coming through with VR just makes some more sense. So we jumped over simulators for that reason. Are we going to get more into haptic response? I'm sure that's going to come down the road.